All right, we are live. So welcome to our staff panel. This is our last live session for today on Giving Tuesday. I'm so excited that all of you have joined us and you are in for a treat with to get a chance to talk to all of our staff, even though it's virtually. They are a wealth of knowledge, so I'm excited for this opportunity for them to be able to answer all those questions that we get all the time. But today is Giving Tuesday. It is around 4 o'clock right now, and we had a match of 5,000 today, and we have met it. So thank you. Yay. We are so excited. Thank you, thank you, thank you. But we are not done. We have a goal of 35,000. So we are up to a little over 30. So please help us to meet that goal of 35 today. So keep donating, tell your friends, tell your family, share our post, all of that today. And thank you so much for supporting all of the work that Insight does every day to care for the most vulnerable in our area. So I'm going to turn it over to Lindsay, and she will guide our panel today. So thank you.
All right, thanks, Robin. Thanks for that update. So exciting about the progress that we're making today. And to round out our day of giving, we have a fantastic panel of my colleagues. So we have Kennedy O'Donnell, our early stage coordinator, Ellie Petoni, our social work coordinator, Caitlin Sloan, our director of marketing, and Kwabina, who is our director of nursing. So we have lots more colleagues who are working behind the scenes and fantastic caregivers and recreation therapists. So we are just a small representation of the amazing team at Insight. We get lots of questions by phone, by email, people who stop into our offices, and there are sort of some frequently asked questions that come up. So during this panel, we'll be addressing some of those frequently asked questions. And as we're moving along, if you are listening live, feel free to type any questions that you have into the comments section on Facebook, and Robin will be monitoring that and bringing those to our attention. So I'm going to start with Caitlin today. I'm going to pick on her. So here's one of the questions that I know you get a lot and I also hear. So Caitlin, this whole world of dementia care is new to me and I'm so confused about all of the options. What's the difference between an adult day center, an assisted living, home care? How do I know what's right for my dad who has dementia and for my family? Help. What do you say, Caitlin?
Sure. So we're super fortunate, specifically in the Northern Virginia area, to have so many resources available to us. But with that comes the complexity of trying to understand what all of them mean. And we encounter so many families who do come to us just recently diagnosed, not knowing what to expect and not really knowing what this means for their family. And my answer to all of them is that your needs are your own and they're very individual. And so I treat every family as such and really work to understand what those needs are and how we can help. And to kind of break down what all of those services are requires me kind of explaining a little bit more and understanding the situation. So what I would tell you just as a brief overview of all of them would be that home care is something that families often consider as a way of starting with care when they start to realize their loved one may need more assistance. They're not comfortable leaving them home. They need to make a trip to the grocery store. They need to be able to get to the doctor as a caregiver, and they're having trouble trusting that their loved one is safe at home. And so home care is a great option for those who are looking for those brief spurts of care or looking to just help supplement and reprieve the caregiver for a brief amount of time. Home care workers are able to come in for 2 hours, for 8 hours, but really the biggest thing with home care is that it is in your home. So people have to be comfortable with that and et cetera. In terms of assisted livings, that's a 24-hour residential community where people do move in. All of their activities of daily living, or as we call them, ADLs, are taken care of there. They're fed, they're clothed, they're showered. There's an activity calendar that's in place. That is really a very care-centric option for families. And most of the families who we encounter are exploring that towards the end stage of their diagnosis and when they're really looking for total support. And again, that 24/7 element of care. For adult day centers is really the socialization component. And unlike home care, people do come to us during the day for blocks of time. We're open, like our day center is open from 7:30 to 5:30. Most are around that same time frame. But the huge difference between Insight and other adult day centers is that we are dementia specific. And so everything about us is built with dementia in mind, whether it be the layout of our building, whether it be the programming that we're offering, everything is dementia focused. And our staff are trained in that element too. And so the biggest thing that I recommend to families is if you contact us, we can help kind of break down all of those different services for you. And all of us, me in particular, are happy to break down what the needs of your family are and how we can help, or how we can help find others who are the best fit for you.
Thank you for sharing that, Caitlin. That was a great description of 3 very different types of care. So my next question is for Ellie. Here it is, Ellie. I've been having a lot of trouble with keeping up my responsibilities at home. These were all things that my husband and I used to share, but I'm starting to become frustrated and overwhelmed with everything. It's now up to me to care for him, clean the house, pay the bills, and lots more. People tell me to take care of myself, but how am I supposed to have time to do that when I have so much to deal with? What are your words of wisdom, Ellie?
Yeah, so that's something that comes up a lot with a lot of our caregivers. Caregiving is definitely not an easy job. A lot of our caregivers go through frustration, become overwhelmed. There's a lot of emotions behind this. And then I know a lot of times it can feel like you need more hours in the day. The 2 biggest things that I could really recommend for caregivers to kind of help get things done more and help their situation, I guess, is to first kind of think about and accept the help that you have. There's a lot of friends, families, services in the community that are always there for you. When I say, family and friends, some things you could do is to create a list of things that maybe they could try to help out with, or even asking a neighbor or someone that you trust to see if they can come over and walk with your loved one outside. That would help, bring your loved one outside, get some fresh air, some exercise, and then that could give you 20 minutes to do something, pay a bill, or even just take a deep breather. The second biggest thing is something that I think it is so important is practicing self-care, especially for our caregivers. You have to take care of yourself in order to take care of another person. And a lot of our caregivers get very stressed and burnt out. And a way to kind of avoid that is to accept those services, to give you some time. There's things like in-home care, which Caitlin mentioned, the adult day center, to have your loved one be taken care of in a good place, but to also give you some time to get those things on your list done or practice self-care. And self-care doesn't necessarily have to be something like a full day thing. I mean, it's always great to try and schedule a friend lunch date once a month or once a week, but self-care can even look like at home, taking 15 minutes to yourself after your loved one has gone to bed. That can be reading a book or starting to read a book. It can be watching a little bit of a favorite TV show you have. It can be enjoying a glass of wine. I don't know. I think it's very important for all of our caregivers to try to find some ways to practice self-care, try to recharge their batteries, because it is a very demanding job. It is a very difficult job, but you're not alone, and there's a lot of support services in the area that are always here for you, especially in site and all of our staff.
Thanks, Ellie. I love that, especially that recharge your batteries, just really such a key aspect of being a great caregiver. Thank you. All right, next up is Kennedy. Here's your question, Kennedy. Insight was a place where my brother would go for a fun, entertaining, and engaging day. Right now, my brother is spending a lot of time at home. I don't have a background in recreation or activities or anything like that, and I don't really feel comfortable leading any kind of activities at home. Is there anything outside of activities that would help my brother? What do you think?
The answer is yes. There are some things that you can do. So, and I've heard this a lot. I know there's a lot of pressure so folks came to our center when we were open, and we do all these crazy, fun, ridiculous activities that keep people, their brains are going all over the place and people are having a great time. And it can be pressuring to try to replicate those things. The fact of the matter is you don't have to replicate those things. And there's a lot of things you can do that aren't activities that are fun and engaging and create a really fulfilling day. The fact is activities are a vehicle for positivity and engagement. It's just something we use, and it's a formula we like to use to make people feel good. I mean, you can do that a million different ways. I think right now it's a little harder, but I after doing some of the virtual calls and connecting with people individually, I've kind of stumbled on some suggestions that I think would help folks right now. I think one of the things that you can do that's not activity based is establishing a routine for someone living with dementia in the form of like setting up calls with their family members or friends. So let's be a caregiver of your brother, or you're close with your brother that has dementia and you want to help them out. What I would do is I would reach out to any other sisters or brothers, or maybe some adult children or some close friends, and ask them if they're willing to make a routine phone call to that person, to your brother. So, hey, John, you mind just calling Bill, Monday at 11:30 every Monday, just to check in with him and, just see how he's doing. And you can let him know, like, yeah, John, I'm thinking about calling you like once a week and just saying hi. Maybe just set up some of those routine calls. It might be a little work on your end to actually reach out and try to organize folks that are willing to make those calls. But I know a lot of people have been doing that with their loved ones that are living with dementia, and it's been working out really well. I think one of the other big suggestions that I would make is to use photos around the house. So pull like every photo off your wall, every painting, like any visual representation off of your wall, and use it as a fun conversation. I can't tell you how much conversation you can get out of one family photo. It's incredible. So if you ever have any time and you feel like you're pressed to do something that's engaging and you're like, I'm so done just watching TV. This isn't a good day for my brother. Try to search for some photos. Even if you don't have any family photos, I don't know, maybe an antique or a knickknack on the mantelpiece. Pull it off the mantelpiece and just talk about it. And just make sure to kind of, while you're doing all of this, the one tip I will give you while you're kind of, engaging with someone with dementia is just kind of give them the authority, make them feel like, they're leading the conversation. It's important. It's not just important to folks with dementia, it's important to everyone. But yeah, I think those are my big suggestions for that question.
That's great. I think we so often forget about that importance of the routine, which probably for many families just kind of feels out the window right now. Trying to establish that routine at home is great. And a great reminder about, like, anything can be an activity. It's just a conversation starter. It's the pictures from the wall, or as you were talking, Kennedy, I was thinking about the plant that's behind you that we were chatting live, right?
Exactly.
Finding something to chat about, laugh about. Awesome suggestions. So thank you.
Sure.
All right, Kay, you're up. Here's your question. I'm worried about keeping my husband safe during this coronavirus pandemic. How do I get him to wash his hands? How do I get him to stay away from other people? And what symptoms should I watch for in case he does develop COVID-19? Give us your nursing perspective.
Yeah, so due to this new virus thing, we've been getting some questions related to that. And first of all, like, I would just say, know that this is like extremely, extremely difficult for everyone. Everybody's going through it. And for those who have dementia specifically, it's like a real, like a big change for them, because just understanding the whole disease process and with their underlying condition is just a big, big issue for them. So I know it's really extreme for everyone. Everyone is really having a hard time with this new virus. And because of the cognitive aspect of the husband's condition, I would say most likely he won't remember things like good hygiene or washing his hands after using the bathroom, or even with the new normal now, just stay 6 feet away from people. Most likely people with dementia will not remember that. Even for us regular folks, it's kind of hard to go to the grocery store just trying to stay away from each other, 6 feet apart. So my first recommendation, I would say, is for those with for the caregiver and the husband, if you can stay home as much as possible. If you have a resource like children or friends or other family who can go like grocery shopping for you on your behalf, that would be a plus, because the more you can stay home, the better it is, and reduction rate of getting the virus increases. So the more you can stay home, the better it is. So that's my first recommendation. Also, if you have to go out, I would say now they recommend putting on a mask and wearing gloves if you're going to touch shopping carts or you're just going to be amongst people in a populated area like a grocery store. If the husband is able to go, he definitely also has to put on the mask as well. Put on the mask and also the gloves and just, kind of go to the store with them to maybe just help pick up the groceries and just keep him engaged. That's if you have to go. The first recommendation, just stay home as much as possible. If he's still insisting on going out, you can actually go outside and just walk around, just to hopefully get his mind off staying home and staying indoors all these hours. I think it gets a toll on everyone. Even for regular folks, just staying home all day without going outside takes a toll. So if you can go for a walk around the building or just leave the house, just go for a walk around the neighborhood where it's less populated, that's also a good one. Also think about some things like Kennedy was talking about, some activities that you can do, like things he enjoys doing at home, so he can get his mind off trying to leave the house or go outside. So if there are some of the things Kennedy talked about, like pictures or even help with prepping food, other stuff that he enjoys doing, and use that as a channel that in a way to help him wash his hands, talking through it. That was also another way to get him to at least wash his hands or even use a hand sanitizer. You may find that that's also helpful in a way to wash his hands. And also while you use it, he uses it, you all do it together, and he kind of mimics what you're doing. Also, the second part of the question was what? Some of the things to look out for?
Yeah, what are some of the symptoms to watch for?
Okay, so I think for the symptoms, they're finding out that it's quite a bit different from one person to the other, but the underlying thing for the symptoms are like high fever. A lot of people are presenting with dry cough and also having some difficulty breathing. There have been some instances where they talk about some muscle aches for some of the patients who have presented with the COVID-19. However, I would say that anytime you notice that there's a sudden change in a loved one, especially one with dementia, and also if there's like an increase in delusions or increase in lethargy, or if they're having like falls or even a significant change in the ability to process things, I would say you should definitely contact their primary care physician. And because sometimes it might not just be a sign of the new virus, it could be just a UTI or pneumonia or some underlying infection. And just, contact the primary care doctor. And if possible, they say stay away from the emergency room, but I guess you have to see what the primary physician says. And if you have to, just take them to the ER or urgent care, and they can probably assess the situation and see what the underlying problem is. Hopefully it's not the coronavirus and it's something else that can be easily resolved. So I would say those are some of the signs and symptoms to look out for: just the fever, high fever, the dry cough, and the change in cognition, as well as sometimes they might feel lethargic as well.
That's a really good reminder, Kay, that other things might creep up. We're also concerned about coronavirus right now, but there could be other reasons, infection or just illnesses. So watching for those signs of change and then calling the doctor before you go into the office. I like that.
Yeah.
Thank you so much.
Yeah.
All right. And I'm going to bounce back to Kennedy for this one. This question says, I've gotten into some arguments with my mom over the past couple of weeks, and I feel like this didn't used to happen. I feel short with her when I go over to her house to check in with her, and it makes me concerned for our relationship. Any advice?
Yeah, big question. So I think the thing to focus on here is this didn't used to happen, right? So and this goes back to Ellie's conversation about self-care. I think the number one most important thing to recognize if you feel like your relationship with your loved one is kind of suffering right now is to really consciously focus and to recognize that the reason that it might be suffering and most likely the reason it's suffering is because of all this abnormal change. It's not normal to have to go through all these abrupt changes, and most likely the root of it is the root of the relationship feeling a little bit deteriorated is because of these changes. So I think that goes back to self-care. It's like focusing on the root of why the relationship might be suffering. It might help you identify the smaller things. I think the other thing you can do is literally lay out in the last couple days what were the things that bothered you. You can sit down with yourself and think about the instances and think through those instances and what you could have done better. Because odds are there might be a couple times where you could have prevented an argument with your loved one by just sitting back and saying, okay, if this conversation pops up again, maybe I should reassess how I'll go about having that conversation in the future. Maybe I'll try to avoid the argument by diverting the subject and just suggesting we go for a walk. Maybe it's not worth it to have that argument once more. Because the fact is, I think a lot of folks, especially folks living with dementia right now, are under a high stress and are having to adjust to new routines. And that's going to lead to arguments. And I think that some of that in a way is unavoidable. So I think that I think that's the best advice I can give, is to just kind of focus on those small instances and think back to them and think maybe how you can do them differently. Because the fact is, I think a lot of that responsibility will be on you to kind of help not repair, but focus on how that relationship can benefit.
That's true. Like I find a lot of caregiving is trial and error in dementia care, right? You try something with your loved one, they ask you a question, you respond in one way, and it maybe goes well or maybe it doesn't, and you kind of file that away and remember that for next time. Like that went well, so let me remember that next time. Like don't argue with my loved one, just go with the flow. Or gosh, the way I responded really escalated the situation, so let me try to be mindful of not doing that again.
Yeah, I think sometimes it's literally a matter of just taking 3 to 4 seconds before responding to something that you feel like is about to evoke some frustration. Just literally taking a couple seconds and think about, what's the best outcome here for both of us.
Right. Take that extra time. And so this is where I'm going to plug support groups. We do have online support groups for caregivers that meet twice a week during this kind of shutdown time. So please join us, get connected to other people who are experiencing some of these relationship changes at home, frustrations at home, and are really learning from each other. This was one of the topics that actually came up in last night's support group. And it was really fantastic to hear all of the perspective of all the other caregivers in the group and how they manage some of these kinds of scenarios at home. So reach out for help. Thanks, Kennedy.
Yeah.
All right, Miss Ellie, here we go. I'm having a lot of trouble trying to provide care to my partner. She always gets upset whenever I try to help her in the shower or with toileting. I don't know what to do anymore because sometimes she gets really upset with me by yelling, and sometimes she'll tell me that she's already showered or gone to the bathroom when I know she didn't. I'm getting very frustrated and overwhelmed with how she is reacting. You ever seen this before?
Oh, yes. So, I mean, my biggest thing to start off with is kind of what you, Lindsay, were mentioning and what you, Kennedy, were kind of mentioning is first, learning about the disease, understanding the behaviors that may occur, you know, really learning how to deal with the disease, I guess. Kind of learning what behaviors could happen, why these behaviors may be happening. A lot of times, you know, we do see this at the center, and I know a lot of caregivers struggle with this, as maybe their loved one starts to yell every time they go to the shower. A lot of times these behaviors can be due to a lot of causes. Probably some of the biggest causes may be because, you know, because of the disease progression, they're not really understanding what is going on. Maybe they're frustrated because they're trying to tell you something, but their communication, their ability to communicate with you has diminished. So maybe, you know, you're not understanding them, they're not understanding you, which creates a lot of frustration and feelings of anxiety on both parties. There are a few different techniques that, you know, we use at the center and that we always kind of suggest to families whenever they are having difficulties with these these daily activities. Kind of going for the toilet or going to the shower. One thing that we always suggest is to do simple, short directions. Oftentimes it takes people with dementia about 90 seconds to fully understand, comprehend what you're saying, and say it's 90 seconds, right? Yes. Sorry. It takes a little bit of time for them to really process what you're saying. So short, simple adult sentences, step by step, explaining maybe why they're going to do this. If you have a loved one who maybe doesn't really want to go to the bathroom or want to go take a shower, some things that we do at the center is kind of say something like, oh, well, we're gonna go and have lunch with everybody. Why don't you come with me and we can just freshen up before we go have meals? You can always use that for breakfast, lunch, dinner, even when you're going out, just kind of say, hey, we're gonna meet some friends. Let's, you know, just use the bathroom before so we don't have to go later or something along those lines. We use the reapproach technique. Sometimes someone may not respond to me, but maybe they'll respond to Caitlin, or vice versa. Maybe another staff won't be successful within that time, so they'll come to me. If you have another person, you can kind of try and do that. And also, if you may be alone, you can always try to take them. If they deny that, then you can step back, come maybe about 10-15 minutes later and see if maybe the timing just wasn't right for them. Some things while you're doing the process is to really try and create a safe environment in that room. While you're showering or toileting them, you want to, like I said, the simple directions, and say what you're going to do before you do it. Say, you know, John Smith, John, I'm going to help you take down to, you know, pull down your pants, and we're going to have a seat on the toilet. You know, before you do that, make those short sentences so they can understand what is going on. And so they're not as scared. So they don't think that you're just taking off their pants, you know, that they know that they're going to the bathroom, that you're there to help them and support them. You can sing them songs. You can play a song that might make them happy and might distract them from the process that you're helping them with. I know at our center, we have amazing care staff. And we have one care staff in particular who always sings You Are My Sunshine to this one participant who is not a fan of going to the restroom or the process. She does tend to yell, not happy. So while this caregiver is walking her to the restroom, they'll sing together, which always just makes my heart melt every time I hear it in my office. But that's a kind of a technique that we use to kind of help calm the nerves before we go. You can also, you know, put pictures, like Kennedy was saying, something that, you know, reminds them of a positive feeling that they have, or, you know, if they're religious, hang a cross or something in your bathrooms. You want to try and make the bathing or toileting experience as calming as you possibly can. Going back to understanding the disease and understanding the behaviors that can occur, I think a lot of times it can be very tough for caregivers to, try and do these activities and then them start to really get upset and agitated. But one thing that I know can be very hard at the beginning is to try and take a step back and, like I said, kind of understand where they're coming from, see that anxiety, and you want to try to reduce that anxiety as much as you possibly can. So yeah, that kind of answers your question. I'm sorry.
Those are great ideas. Absolutely.
Just to piggyback off of Ellie, I feel like this comes up a lot with caregivers. And the biggest thing I recommend is allowing for as much autonomy as possible.
Yes.
There's a lot of, if anyone were to just tell me to go to the restroom and start pulling my pants down, I'd be very agitated. That's not a dementia symptom. That's just a human response. And it's allowing for as much as autonomy as possible. It takes longer. It's more frustrating. It's just a lot easier for us to do it ourselves and to just, but at the end of the day, each person is an individual who deserves that respect and that autonomy. And yes, it takes longer. It takes giving us the 1, 2, 3. Okay. All right. I'm going to wait for you. Okay. But yeah, that has helped a lot. And I think it's really easy to overlook when you're in the trenches of caregiving too, allowing for that autonomy for the individual.
And letting them kind of have that decision can definitely probably uplift their mood and make them maybe a little bit more willing to go through the process that you want them to do.
Right. Investing a little bit more time in preparing for that task and making a connection and being patient during the task, I bet will save caregivers a lot of time and frustration for the rest of the day. Right? You kind of, if someone gets into that negative spiral, it just makes the next many hours really hard for both of you. So taking that extra time can really help accomplish the task, but then help you both feel really good at the end of it. Thank you so much. All right, Kay, this one is maybe a little bit related in that it's some type of a behavior change. So here's the question. My mom will not take her medications when I try to give them to her. She clamps her mouth closed and won't open it. How can I help her with this?
So this is, I would say it's a common problem that we typically have at the center. So especially when participants get to the middle to late stages, it becomes quite frequent. So the first thing I would suggest is to try and problem solve. Just try to find out why she isn't opening her mouth. And often around, I say the middle and later stages, it just gets harder for them. It's just at that stage of dementia where they don't understand verbal directions clearly. They're not processing it like they used to before. And it may be that the caregiver's mom just doesn't understand what he means by just take your medicine. So I would suggest that maybe if he can be a little bit more clearer and probably put in a different way by saying, can you open your mouth? Or even try to make him mimic or mirror him or her, the caregiver, by just opening his mouth and then putting something in his mouth and doing the same with the mom, trying to say, not like a kid, but just try to mirror what he would do and see if the mom will do the same. And also it could be that the mom might be maybe having a toothache. Sometimes that is a problem, but they just don't have the means to tell you they're going through the pain. Or maybe she's just not comfortable with the texture or the feel of the pill itself. And in this case, if that is a case whereby the pill is not comfortable for her to swallow or even chew, you could just basically ask the doctor if there's another form of that medicine. So it could be either a liquid or a patch, if that's possible, so that it can switch it to either a liquid or a patch. Also, if there's some medications have the extended release form, where instead of giving the medications 2 or 3 times a day, with the extended release one, it could just be given once a day. So if most of the medications can be switched to once a day medications, that will also help with the discomfort of her not opening her mouth. And the medications could also be given, if you notice that your mom prefers to take or is better suited to taking medications in the mornings or afternoons, since it's switched to once a day, you can just target the medications to be given at that particular time of day. And one of the other things that most families also do is just to consider the benefits of certain medications. Because if, like, for example, giving vitamins or just giving some supplements or other medications are causing a distraction or frustration, you just have to weigh the benefits of giving those type of medications, if it's really worth it for her to go through this discomfort or frustration. And a lot of families at some stage of the disease process tend to stop giving those type of medications. So if it's not really a real benefit to it, and you feel like you can stop that without having any effect on the disease process, it's okay to also stop those type of medications. So let's say there are important medications that you really want her to take them. You could try crushing it, those medications as well. That's another technique we use. A lot of times, some medications, they say do not crush, but when it gets to a certain stage, you have to outweigh the pros and the cons of it. So most physicians, when you talk to the primary care doctors, will usually tell you it's okay to crush them. And because if it's an important medication that she needs to take and she's not opening her mouth, if you're able to crush it and just put it in her favorite food, it could be just like a chocolate pudding or ice cream or a peanut butter sandwich, whatever she prefers to eat, you try to put it in that. And I think with that, a lot of times people find success with that and they are able to give the medications that are needed. Also, you can try to find other ways to give her like a feeling of control and respect, and just to take a few seconds, like Ellie was saying, just a few seconds out of your time just to either sing or make her laugh or smile. Just a few seconds, 30 seconds, 60 seconds, just to be calm and relaxed, just to give her that one-on-one feeling of respect and that she's in control. That sometimes tends to go a long way for her to take the medicine and also for you as a caregiver to also accomplish your task. So these are some of the things you can do if a patient or participant is not taking the meds. These are some things that goes to help them take their medications.
Thanks, Kay. Those are some really good, practical tips that people can try at home. So thanks so much. And we have one more question that we've prepared in advance, but I'll remind you, if you're watching on Facebook Live, if you have a question, go ahead and type it in the comments box, and we would be happy to take it before we end this live broadcast. So our last question is for Caitlin. So here we go. I'm so overwhelmed caregiving for my wife at home. Every day is getting harder and harder for both of us. I know that you have an adult day program, but I don't see how I could get my wife to agree to go to your center. She doesn't think that she has a problem. What do you suggest?
I'd say 1 out of 10 people I meet want to come to Insight. The other 9 do not want to be there at first. They don't need us. Why are they here? They have so many other things they need to get done at home. They need to pick up their kids. We talk about this a lot with caregivers when they first come to Insight, and it's a big change. And the idea that somebody who's so accustomed to their home is now going to be branching out into this group with so many other people and seeing different types of people is a huge adjustment. And the best thing that I recommend to them is to let us know the individual. The more that we can know about them, the more that we can plan for them, and the more that we can personalize their experience at Insight, the easier the transition goes. And I can say that everybody who has enrolled in the program and who has stayed the course and who has been with us and who has taken advantage of the programs and really has felt the joy of being a part of such a large community will testify to the fact that being a part of a community, as big of a leap of faith as that was for them to start to face those emotions and those fears of coming to an adult day center, that they were ready for that. They will testify to just how much value it added to their life and the purpose and the meaning that it gives people with memory impairment. for caregivers, it was lean on us to provide a safe environment and to provide the activities that are meaningful and give people with dementia a reason to wake up every day, that they can look forward to sitting next to this participant during art therapy, or that they can, you know, check on how our pregnant social work director is doing, and those relationships that are made, that's the value. The community is the biggest part of Insight, and I think the biggest asset to all of the staff and to everybody who comes through the doors too. And acclimating to that just takes time. And so the more we get to know the more we get to know the participant, the more we can do to make them comfortable. And that looks like structure, that looks like working with the caregiver, communicating how their days are going, you know, setting them up for success. And what I tell most families when they meet with me is that it takes about 3 weeks for this to become normal. Those first 3 weeks can be a bit of, I don't know what this place is, and I don't know what I did today, and we say, well, they actually did a lot of things today. They just may not remember and may not be able to share that with you. And so the biggest thing is just you understanding that everybody at Insight has the participants' best interest in mind. And we want to do everything we can so that this is a safe place, a comfortable place, and a place where they feel comfortable to be exactly who they are.
Thank you so much. So I'm going to invite Robin to rejoin us and let us know if there any comments or questions have come through on this feed. And I also just want to remind everyone who's watching, you might be thinking, well, yeah, all these things sound pretty great, but we're all stuck at home and your building is not open. But we are offering virtual programs. So our support groups are online, our classes are now webinars. We do consultations over the phone and by video and by email, and even our reconnections programming and day center programming is still happening virtually. So please don't hesitate to look into our services and to ask questions about them, because we are still very much active and supporting families at this time. So Robin, what do you have for us?
So donations are just flying in. So I am so grateful. Thank you guys again for doing this panel. It has been fantastic. So I am happy to report that we are at 32,000 of our 35,000 goal. So we're close. We have 3,000 to go. So really come out, donate. Every dollar counts. It really helps. The virtual programs I know have been so helpful for so many families and participants to be able to stay connected as our new reality is here. But we want to make sure that we're able to come out of this COVID-19 unprecedented time stronger. I think as staff, we have all come together to figure out ways to be creative and to make sure that we're able to reach as many participants and families as we can, and even enroll new participants into the programs, which we have done. So you can definitely feel free, reach out to us, go to our website, insightmcc.org. to learn more about our organization, what we are offering now, and hopefully soon we'll be able to open our doors and have the programs operating fully, as we are all waiting for that. But today is a day of giving, so please continue to give and help us to reach that $35,000 goal. So thank you so much.